Warm welcome to everyone, and thank you for joining us today. We're getting started a little bit late. We were just had some issues with the sign language interpreters. But I'm really pleased that you're all here today for this webinar on gender responsive social protection priorities, challenges and opportunities for GRSP in East Asia and the Pacific. Before we begin, I would like to acknowledge the Ngunnawal people as traditional custodians of the land in which I am joining this session today, and acknowledge and respect their continuing culture and the connection to the lands of the ACT and region. I would also like to acknowledge and welcome other Aboriginal and Torres Strait Islander people who may be joining today. This webinar is the last session of a two-part webinar series, Pathways to Inclusive Social Protection, organised by the Australian Government's Department of Foreign Affairs and Trade in partnership with UNICEF and hosted by socialprotection.org. The webinar series draws on experiences from the Asia Pacific and offers globally relevant insights on social protection, guided by gender equality, disability and social inclusion principles, and explores how social protection systems can be designed to address barriers for persons with disabilities, women and marginalised groups. It follows the first webinar held last month, Beyond Cash Transfer, which looked at integrated support for inclusion for persons with disability, also co-hosted by DFAT and UNICEF, and the recording and slides for that webinar are available on socialprotection.org. My name is Jackie Powell and I am the Assistant Director of the Social Protection Development Advisory Services section at DFAT, based in Australia in Canberra, and I will be your moderator for today's session. This webinar launches the findings of a regional study of gender responsive social protection in East Asia and the Pacific as a launch pad for regional discussion, and the aim is to generate dialogue between governments, experts and civil society to explore practical steps forward, exchange lessons and strengthen regional collaboration on GRSP. This work is supported by the Empowering Girls and Women Through Social Protection in Southeast Asia program, which is funded by the Australian Department of Foreign Affairs and Trade and implemented by UNICEF. Next slide, please. Before we begin, I'm just going to run through some key points for us all. So the session is being recorded and it will be available along with the presentation on socialprotection.org and sent to all registrants after the session. We'd like you to use the chat box to present yourself and make comments or share useful links. We have sign language interpretation, thank you to the signers, and the sign language interpreter's video will always be spotlighted. To see the live captions, you click on the bottom of the screen where it says CC, closed captions, that button. And finally, please share questions that you may have as you're listening to the webinar through the Q&A. State your name and organisation and also the context of your question and who it's been directed to, if it's been directed to a specific speaker. Okay, so the webinar will run for 90 minutes. We'll have some opening remarks by DFAT, a presentation by UNICEF and some reflections from two speakers that we have from the region today, followed by some Q&A and some closing remarks. We are joined today by a number of speakers from DFAT, from UNICEF and from the Asia Pacific region, and I'll introduce each of these speakers as we move through. First, we have Elizabeth Cowan from DFAT. Liz is our Senior Gender Equality Specialist and Director of the GEDSI Performance and Effectiveness section for DFAT. Liz will introduce the webinar theme, the relevance of GRSP and its link to DFAT's strategy and objectives. Over to you, Liz.
Thanks, Jackie, and it's so nice to be with you all today. Thank you for having me. So as Jackie said, we are really pleased to partner with UNICEF for the webinar today. And especially, under our program, Empowering Women and Girls through Social Protection in Southeast Asia, which supports partner governments to ensure that social protection policies and programs respond to the needs of women and girls. Australia knows that social protection is critical to enable people to respond to the challenges that we all face at different stages of our lives and to strengthen resilience. This is why Australia's international development policy commits to supporting partner governments to build social protection systems in the Indo-Pacific region. Quality social protection systems and programs can support positive change for gender equality and disability equity, which are two of the core issues for action under Australia's international development policy. This is important for Australia because we know that gender equality benefits everyone. It is a necessary foundation for peace, prosperity, and stability. It drives economic growth, enhances social cohesion, and increases the well-being of all members of society. In February this year, and in a very difficult geopolitical context for gender equality and women's rights, Australia was really proud to release our newest international gender equality strategy. It reaffirms the centrality of Australia's commitment to gender equality and advancing the human rights of women and girls. And it highlights that social protection, including cash transfers, insurance, and in-kind support, is critical for women's economic equality. Social protection can help to reduce women's economic vulnerability, prevent gender-based violence, address unpaid care work, and support access to good nutrition, health, and education services. I know that there are no silver bullets, but I think social protection is pretty amazing. It alleviates policy and enhances community resilience by providing critical safety nets during economic and other shocks. And it supports effective, accountable, and resilient states. Social protection can also be designed to help address the gendered impacts of climate change and the particular risks faced by women and girls during periods of social and economic crises. Social protection is a precondition for the inclusion of people with disabilities, and this is recognised in Australia's third International Disability Equity and Rights Strategy, which was released late last year. To develop the Disability Equity and Rights Strategy, Australia consulted extensively across the region, including with people with disability, and social protection was highlighted as one of the key priorities from the movement. Our Disability Equity and Rights Strategy recognises that social protection is critical for people with disability to achieve their rights. For example, disability support payments enable people with disability and their families to pay for the extra costs associated with having a disability, such as medical and health services, education and training, transport, and livelihoods activities. And it enables people with disabilities, including women and girls, to participate in learning, economic and social and community activities. Building a social protection system that is responsive to the diverse needs of any country's citizens and changing contexts takes time, it requires forward-leaning policymakers, and it requires resources. But we believe that this investment is well worth the effort. As well designed and implemented, gender-responsive social protection will have lasting benefits. I hope that the webinar today will provide an opportunity to learn, reflect, and consider a way forward to ensure social protection achieves inclusive and equitable outcomes for women and girls, and ensuring that we are leaving no one behind. Many thanks to all the panelists for sharing their expertise today, and I'm looking forward to learning from you all. Thank you.
Thank you, Liz. We'll now move to a presentation by UNICEF. So first we have Shreyasi, who is a Gender Equality Advisor with UNICEF's East Asia and the Pacific Regional Office in Bangkok, and she'll provide an overview of the UNICEF Gender Responsive Social Protection Project. We also have Sinta Satriana, who is the Regional Social Policy Specialist also at the UNICEF East Asia and the Pacific Regional Office, and she'll present the key findings from the GRSP landscape mapping, including the top challenges and policy opportunities that emerged from that study. Over to you, Shreyasi and Sinta. Thank you.
Thank you so much, Jackie, and thank you so much, everyone, for joining us today, and Elizabeth for that introduction. So, colleagues, we would spend the next few minutes sharing with you the work that we've been doing under the Gender Responsive Social Protection Program, and specifically looking at the findings that we have from this report on the landscape mapping of Gender Responsive Social Protection Program in the East Asia and Pacific region. As Liz mentioned, it is fundamentally important for us to bring that gender and inclusion lens when we're looking at social protection program. It's absolutely essential. And there are multiple reasons for doing so. The first one is because addressing the gender inequalities is extremely important for our overall poverty reduction goals, and it's also important for us to look at the gendered dimensions of poverty itself. When we bring that gender equality lens to social protection program design, implementation, monitoring, we're also helping promote gender equality goals. So it really is a win-win approach for us to be looking at gender responsive social protection and applying that lens to this program. On the other hand, on the flip side, if we do not look at gender equality, if it is overlooked or if it's inadequately addressed, we find the social protection programs can actually worsen the outcomes for women and girls and for other vulnerable populations. So with that context, for the last 2.5 years, with support from the Government of Australia, we have been implementing a program on gender responsive social protection in East Asia and Pacific region. This program has 3 components. The first component looks at evidence generation. That's the part that we will be focusing on for our presentation today. We also look at capacity building and influencing policy advocacy. Under the evidence building, we started off by looking at the landscape of social protection in this region, especially looking at the extent to which social protection programs, social assistance programs are actually addressing gender inequalities in the program design, implementation, and monitoring. We also undertook a detailed political economy analysis in 5 countries in the social protection sector, and we're now moving forward with really doing a deep dive in a few countries. Based on the gaps that we've identified, we then have started doing capacity building and training for our key stakeholders in these countries to be able to address those gaps. And we're now and simultaneously working on policy advocacy so that we can really start to shift the needle when it comes to addressing gender inequality through social protection programs. So I'm going to hand over to my colleague Sinta to really take us through the findings from this research. Sinta, over to you.
Thank you, Shreyasi. I hope you can hear me well. So as Shreyasi mentioned, we have 2 components basically in the study. First is looking at overall East Asia and Pacific, how gender responsive are social protection systems in these countries. I'll also cover briefly how we did that. So basically, this came from a need where there's no currently comprehensive study that maps gender responsiveness of social protection system across the region, and especially there's limited analysis of gender, political economy, and social protection, and we felt the need to do that in a few countries. So quickly on the approach, we started with 27 countries that UNICEF covers in the region. We ended up with 19 countries where we have good, solid data. Some of the countries are excluded due to specific context or unavailability of programs or information. So this is a a desk study looking at two components. First is the strategy or policies, looking at national social protection strategies, policies, but we're also looking at the program level. The regional landscape mapping has 19 countries, and we have 21 strategies from those 19 countries. Some are national social protection strategies, some are legislations on social protection, and we focus on social assistance or tax-based programs. And from these 19 countries, we have 153 programs that we included in the analysis. This does not include all social protection programs, of course. These are a good size where we could have a good idea of how different programs are responding to gender, or how they are looking at gender in their design and implementation. And then at country level, we've conducted gender political economy analysis in 5 countries. This is to kind of give that deeper understanding of what's happening at country level, how gender have been or have not been considered in social protection designs, and how the different actors are influencing these decisions. So the regional landscape mapping is in the last stages of editing. We will be publishing it very soon, and we will have the document at socialprotection.org. The country case studies are currently being discussed with each of the government counterparts, and we will be announcing when they are out, when they are published as well. So quickly on the overall findings, what's really interesting is that there's a big gap between policy and practice, because we were looking at this level, policy or strategy, and then program, right? So many strategies commit to addressing gender inequality or gender risk and barriers. It's around 50% of strategies have very specific acknowledgement of gender barriers, differences between the two genders in terms of economic opportunities that affect the effectiveness of social protection. Some of them specifically mention, gender programs, social protection programs should be gender responsive, and so on. However, so this is good, right? So you have half of the policies specifically acknowledging gender. However, at the program level, when you look at how gender is actually integrated in the design, or even in the in acknowledging gender barriers, the number drops significantly. So that means these commitments at policy level often do not translate into meaningful gender responsive programming. So around 15% of social protection programs actually have specific gender objectives, or specifically mention that gender is a consideration in designing their programs, or that there's specific gender-related protocol in implementation of the program. So this gap is very very visible. And the other thing is that those who do have gender objectives or very clear gender consideration in the programs, they are often narrowly focused on women's role as mothers and caregivers. We can then look at the specific issues or specific gender vulnerabilities or gender barriers that are mentioned in these policies when you look at policy level. So most policies acknowledge gender-based violence as an issue, and that's something that social protection needs to contribute to overcoming. And number two, you have a lot of mention on care work, the care responsibilities that women have that becomes barriers for their economic, political participation. And these have to be acknowledged in social protection policies. Other issues, such as issues faced by girls or adolescents and economic disadvantages, climate shock vulnerability also appear there. But you see that gender risks among younger people, younger women, is much less visible in these policies than adult women. So again, gender-based violence and unpaid care work are the most recognized issues. If you look at the program level, there's pronounced focus on women's role as mothers and caregivers. So this is quite consistent between policies and program. We see that, especially at program level, there's very limited attention to other aspects of women or gender diverse individuals. For instance, programs looking at economic and political participation and other aspects outside of their role as caregivers is very limited. So what you have is a lot of programs for families, for children that are, targeting women, but really looking at outcomes for the families, and women are, taking the role as caregiver as the one taking care of the benefits and distributing it and using it for the families. What we see also is that while at the policy level, we see a lot of gender-based violence and unpaid care work or the lack of redistribution of care work, at the program level, this is really missing. So what you have is programs really treating women as caregivers and really keeping that role unchanged. Some might say, preserving their role as the main caregiver. But if you look at programs trying to provide concrete support to reduce and distribute care responsibilities, it's really very minimum. So we're looking at programs providing transfers specifically to reduce care work, for instance, or programs providing cash transfers and linking to cash to care services, or cash plus care programs where you specifically provide cash and the referrals to care services. These are still very few. Again, similarly for gender-based violence, although it's very pronounced in the at the policy level, there are only few programs offering tangible support or services, linkages to services for gender-based violence survivors. So we're looking at cash or in-kind assistance specifically for gender-based violence, or cash plus access to protection services, legal services, and so on. These are still very limited, although we do find them in some countries. So going to the key recommendations, the first one that we recognize through this study, as well as through our activities at country level, is that we need to invest in training and capacity building. And this is exactly what our program is doing now. As immediate follow-up, we are partnering with the government agencies in providing trainings, capacity buildings, conducting policy dialogues to equip policymakers, designers, and social workers with gender integration skills through training programs with the government. So the second point is that we need to institutionalize regular gender analysis. And this is missing in many, many programs. And this is what our discussion has come to when we are doing the capacity building activities as well, is that when we provide the practitioners with really concrete steps in doing gender analysis, it was very useful. It was sometimes quite eye-opening that, oh yeah, we need to do gender analysis. We need to see how gender is affecting, the different populations we're looking at before we design the program. And as we are delivering the program, we need to see how gender is affecting the populations, the communities, and how we need to tweak our design and implementation and so on. So these are very practical, very straightforward steps for designers and program implementers that can be taken basically immediately at any stages of the program implementation. The third one is strengthen gender data system. This is, I think, quite obvious for everyone here that there is still a lack of gender disaggregated data in many, many countries, and this needs to be strengthened, and that everybody needs to see the value of having better gender data system in really strengthening the program design and implementation, as well as evaluation, of course. Also, of course, we need to leverage income security for gender equality. This is what social protection is all about, providing income security. And when we look at that, when we look at programs from this perspective, it's that gender equality can really be supported by leveraging income security for the specific populations, program beneficiaries. Then we can really optimize the result of the program. Just my last slide is on a few more recommendations. What we saw, as I mentioned earlier, is that also adults and girls and young women are rather invisible in both policies and programs, and this needs to be recognized, and policies need to look at the needs and the risks faced by adolescents and young people, because currently programs that are looking at child marriage, school dropouts, transition to work, and how they are affected by gender is very, very limited. Again, many of the programs are focusing on women as caregivers, as mothers, right? So the next one is to strengthen system linkages, of course, because you cannot achieve, you cannot improve gender equality without having the different sectors working together. We may provide cash transfers through our social protection programs, but we need to make sure that, in terms of improving education, that education services are accessible, and social protection programs can provide the linkages, facilitate access to beneficiaries. We want to improve health. If it's general health outcomes or reproductive health, we need to make sure that there are linkages to health services and so on. And as this is the same with labor participation for women, livelihood programs. These linkages need to be made more clear and made more prominent. And also, of course, we need to create inclusive negotiation spaces, ensuring that civil society and women's rights groups have clear roles in shaping policies. And we will have another speaker from Indonesia later on speaking about, how CSOs can really facilitate improving the outcomes of social protection programs at community level. I think this is very important. And we see from the study, both at country level and at region level, that this is still very minimum at the moment. And the last one is that we need to leverage existing gender mainstreaming structures. They are often existing already in countries. Different ministries have, gender budgeting tools, gender analysis tools that are that may or may not have been used for social protection design, implementation, and evaluation. So this is about, linking, improving the collaborations between ministries and the different expertise, because gender responsive social protection is, of course, not going to be achieved without these different sectors coming together. So that is all from us. Happy to discuss during our Q&A session. Thank you.
Thank you, Sinta, and thank you, Shreyasi. That was a really excellent presentation, capturing a lot of thinking. And I'd just like to thank the UNICEF team from across their network, drawing on their gender and social protection advisors and others working on social protection and gender in the region for this study. And I'd also like to acknowledge the amazing research team that drew on a range of local researchers who did an incredible job, and also the team at Ladysmith that supported the study and did the research. We're going to move on now to some reflections from our region. So we have two speakers. We have Sopheap, who is a social protection specialist with the Department of Policy at the General Secretariat for the National Social Protection Council, GS-NSPC, is how it is known in Cambodia. And we also have a speaker from Indonesia, Ibu Nerina Widago, who is an executive director for Kemitraan, a partnership for governance reform, civil society organisation, and she will also be sharing some reflections on the study that you've just heard the findings of. So Shreyasi is going to kindly facilitate this session. So over to you, Shreyasi, if you have any opening remarks that you want to make, and then we'll ask Sopheap and Ibu Nerina to speak. Thank you so much.
Thank you so much, Jackie. And maybe just a very quick, framing point from my side. We have, as I mentioned, as part of this program, been doing deep dives, political economy analysis, but also looking deep dive on the social protection landscape in the country, as well as undertaking capacity building activities. So what we will be hearing from both our colleagues from Cambodia as well as from Indonesia is really looking at some of the insights from the capacity building, and maybe also looking at where the bottlenecks still exist and how we could actually come together to work on addressing some of these remaining challenges. So maybe over to you, Sopheap, to hear from Cambodia first. Thank you.
Yes, thanks Shreyasi, and thanks Jackie and UNICEF and DFAT for organizing this event, and also the opportunity to share the showcase from Cambodia. So hello colleague, my name is Sopheap. I'm a specialist from the General Secretariat for the National Social Protection Council. And the session today is an opportunity to showcase how Cambodia in the social protection sector try to promote gender equality. And as Shreyasi mentioned, the case study in Cambodia is the finding would also echo the finding from the finding that UNICEF just presented earlier. So without further ado, I will just quickly introduce what is the social protection system in Cambodia? So social protection in Cambodia is a mix of contributory scheme and non-contributory program. The non-contribution or so-called the social assistance program, which is the government-funded program and is provided to the poor and vulnerable household. Those households, they entitled to different social services, and it's a family-based. While the contribution scheme is for the well-off population who are able to contribute to the National Social Security Fund, and in return they receive protection for health care service, work injury, and pension. This is just an overview, so you're familiar with our system. Related to gender, why gender is matter? I think Sinta and Shreyasi have mentioned already. To address, to promote the achievement of social protection, we need to address gender. Gender is always matter, as women experience different risks compared to men. And as Cambodia is a richness country, so the strong cultural norm and traditional practice is influence a lot on the woman life. So we need to consider and take all of this into account to make sure the system is designed for everyone. Yes, so we can move next. Currently, there is a few gaps that we can identify in the country. As I mentioned earlier, our social protection is targeted. We are adopting the targeted approach. So those who are poor were identified and they access to service, they are provided healthcare and support. And those who are well off, they also receive protection through the National Social Security Fund. While there is some group are still missing, like those who are middle income and also those who are working in formal sector. And another gaps is the inadequate gaps that refer to the service provided or the benefit provided is for a single program. We have different program, and each program have different objective, different target, different benefit, and the program not talk to each other, which a lack of systematically link the service or support to the beneficiary. And another gap is the system and access gap, that currently we have limited data on gender, data analysis, that and it's a challenge for us to really identify or may lead to missing any groups. And the last one is the gender knowledge and capacity gap to translate the strategy into practice, as well as to adopt the concepts into the design. Yes, so how we address this gap? Next slide, please. So by acknowledging all these gaps, our government has worked a lot to promote the gender equality. As you can see on the screens, the green box is the new National Social Protection Framework 2024 and 2035 that has been updated and shift from the pillar-based to the life cycle risk approach with an aim to protect all the citizens from the birth until the old age. I will explain further what are the life cycle risk later stage. But in addition to this, the framework also aims to improve the coverage to address the coverage issue by strengthening the targeting mechanism, which is currently so-called the identification of poor household that mandate to identify poor household for government-funded program. So we aim to address this system, improve the mechanism to fully identify and have more flexibility that can capture the real situation based on the trend of the socio-economic in the country. And at the same time, we also aim to improve the National Social Security Fund registration that we hope to expand more coverage to those who are not meet in the current eligibility criteria. And we also in the process of developing the integrated social protection digital platform. That is the platform develop a single registry, so we can track the service and also follow up also the data, gender data that help us in identifying the missing and what are the needed service that we should focus on. And last but not least is the strategic alignment. We have worked closely with Ministry of Women Affairs. The strategy alignment, like the social protection strategy, align with the gender equality strategy, and we also work closely with the Ministry of Women Affairs for back and forth exchange information and set the priority. Yes. Next, please. So these are the 7 life cycle risks that the new framework intend to cover. You could see on the right hand of the inside the screen, social protection resembles as a house to protect all the household members who have different risks, from the maternity and childhood to the old age. So currently, many programs has been introduced at each stage of the life cycle risk. And some program, for example, the maternity and childhood risk, we have cash transfer, we have scholarship program, homegrown school fitting program. And there is an ongoing program that called National Social Protection Program for the Family Package. It is an integrated program that addresses several life cycle risks at the same time. So the family will receive a flat rate amount to support their livelihood, and in addition they will get extra amount if the family have the household member who are pregnant women, the school the children with the school age, and the member who are living with disability, member who are living with HIV, also elderly. So this is one of the ongoing program that try to address several risks of the life cycle. Yeah. We can move to the next slide. Yes. As I said, this is the approach that we adopt in the development of the new social protection framework. This is, we call it as a guiding principle or a Bible that we have to consider all the 7 guiding principles in every design and the implementation of social security scheme, as well as the social assistance program. You can see the 7 guiding principles, the gender responsiveness, which tell us that in every program, at every stage from the design, implementation, monitoring, we have to consider about gender and have to focus and bring it into the center of the design. Yeah. So I would like to move to the next plan. After hearing all of this, what we will do next, we will adopt the gender responsive principle into all the social assistance program and social security scheme, including the M&E mechanism. We have the M&E framework for the social protection system as a whole, and we will adopt this guideline to see if the indicator has been mentioned, what are the missing part, what are the data we need for our targeting for gender mainstreaming or gender addressing the gender inequality. In addition to that, we also addressing the data limited on strengthening gender data and analysis. We, with the support and collaboration from our DP, we have analyzed the gender analysis for social protection system as a whole. But as I said earlier we have different programs in the system, so we might need to deep dive into each program to see how each program was designed and identify where are we now. Are we gender responsive? Are we gender transformative? I think the answer to this question will help us a lot to identify the gap and fulfill those gaps. We also currently have done the gender analysis for the family package program, and the result will be shared later. And we will see whether the program have to ease or create extra burden to the female member. In addition, we also improve capacity building on gender responsiveness in social protection by provide training to relevant actor, not only implementer actually, but we also plan to provide the training to policy maker, regulator who are responsible for overseeing the regulation of the National Social Security Fund. And we have provided training already, and we are in the process of rolling out the training to the other at national and subnational level. And furthermore, we also in the process of design the Case Plus program to the family package, which means the ongoing family package, those beneficiaries will receive additional social benefit or social services in addition to the cash transfer. But this is currently in the design. We will hope that the design would improve the gender equality in the country and provide the comprehensive social protection service to all the vulnerable and poor population in the country. And the last point, yes, of course, to achieve the gender equality, we need to engage more women, and we try to advocate and promote women voice in the policy design through different consultation with women group at the ground level, at policy level, and implementation as well. Yes, I think that's it from my side. Thank you so much for your listening. Yes, looking forward to discuss further in the Q&A session. Thank you.
Thank you so much, Sopheap. And it was really good to hear, like what's happening in Cambodia, but also like the concrete examples that you talked about from the policy side, as well as the specific program, the family package, the gender analysis that is ongoing right now. And we're looking forward to what comes out of that as well and working with you. I would now like to maybe turn to Ibu Nurina. Ibu Nurina, thank you so much for joining us. And Ibu Nurina is Executive Director of Kamitra, the Partnership for Governance Reform, and she's joining us from Indonesia. Over to you, Ibu.
Thank you. Greetings from Jakarta. It's my pleasure to be part of this discussion. So first, I'd like to introduce a little bit more about Kemitraan. This is a non-profit organization that works with everyone. So we are a multi-stakeholder organization that has been working with civil society, of course, but also with the government. And we have been partnering with many different types of organizations, including the DFAT Australia. So in this case, I would like to share what we have done with support from Inclusi, which is a DFAT Australia project that works to promote the rights of those that are disadvantaged. So women, people with disability, but also other types of organization. So communities, I mean. In this case, Kemitraan works with indigenous communities, those that are live in very remote areas, and they have their own particular cultures, and we want to make sure that they are also part of the discussion of the benefit, getting the benefit from the development that everyone in Indonesia is enjoying. But they have their own particular situation. So I'm sharing what we have done in Indonesia with support from Inclusi, which is the project on social inclusion. And this particular example is particularly about women in indigenous community in Indonesia. So I would like to start with the different types of social protection that Indonesian government has provided to our communities. So anything from the Family Hope Program, which is basically handing out cash to those that are very poor, or the non-cash food assistance, those that are not that poor but still need help for making sure that they have enough food on the table. But also we have education program that we call the Indonesia Smart Program. So basically it's a subsidy, but also access to education for the disadvantaged and poor families in Indonesia. In terms of the Social Security program, we have two main entities in Indonesia at the moment. First on the health insurance, and second on the employment social program. I can say that the schemes for social protection that we have in Indonesia are quite good. However, it doesn't reach everyone that are supposed to receive the support. I'll talk about that a little bit more here. So when it comes to the indigenous people, especially those that are living remotely from the main village or main administrative entity, these people, the indigenous communities, are not yet in receiving the social protection, social programs that are provided by the government. Why it's so? So first, I'd like to say that the indigenous people themselves, especially the women, they have their own limitation. They live so far away from where the services are provided, but also they don't have, for example, the identity card, birth certificates, that kind of things that become the requirement before somebody can access the services. To make things a little bit more difficult or even more difficult is their own internal situations, that there are discrimination, quote unquote, for women, for children within their own indigenous community system. So these are the internal limitation that have limiting the access for indigenous women and children to some extent to receive the support that are provided by the government. Stigma is another problem because we have external people, external community have wrong imagination, but also perception about the indigenous communities. For example, they are so left behind that we don't understand them, or their belief system is so peculiar, or that they have certain behavior that are not acceptable. So those stigma have added problems for the indigenous communities, especially women, to access social protection services. And as I said earlier, this community lives so far away from where the center of the services are available at the subnational level. So because of the distance, because of the difficulty to reach their areas where they live, geographic limitation is adding to the problem. And it's not necessarily easy to overcome because transportation is a problem, or even if there is access through road, the road is not so good, or if it has to go through the river, the cost to take a boat to go to their location is also expensive. As I mentioned earlier, there is also a procedural barriers, the requirement to have certain documentation. They don't have the ID, they don't have the birth certificate, that kind of things also limit their access to the services. I would also like to mention about the multi-layered injustice because they are a woman, because it's a child or with somebody with disability, is adding to the problem to their ability to access the services. So these are the 5 main challenges that indigenous communities, especially women, have to overcome before they can access the social protection services provided by the government. Okay, Kemitraan working with Inklusi have developed a number of strategies. One, we think that if these communities, these ladies, these women have money in their pocket, they will be more empowered. So we provide economic activities so that they can have better economic capacity, so that they can also have more bargaining position. That's what we think as our first strategy. The second strategy, we work with our local partners to do the policy advocacy, that the policy that the government has or the local governments have should also able to reach out to this community. We work with our partners on the ground, but also we promote the indigenous community themselves, their leaders, to be able to advocate for their own improved situation when it comes to the government policy. Number three, that is also important, is our support for internal empowerment, so that their own governance system will also be able to empower them, the members of their own community, but also for them to be more confident, to be more able to bring out their concern, their demand, and make it happen with the local government, for example. So internal empowerment is the third strategy that we have developed so far with our partners for the indigenous communities that we are serving. Okay, what are the two things that we want to see to happen? So first, I think the service providers, the local governments, the communities that are working with these indigenous people should be able to overcome the stigma problems, because with all the stigma, it will be more difficult for the service providers to reach out to the indigenous community. So this is what we want to see to happen first, so that the service profession can be also enjoyed by the indigenous community, including the women. And second, I think this is very interesting, because we think that the services provided will be will match what their needs. Not necessarily so, because one of the service provided by the government when external shock happen, for example, is the provision of rice. Indigenous people produce their own rice. They don't need rice, but the support provided by the government is rice. So they receive a bag of rice, while actually they don't need that. They need something else. So the contextualization of the services, the social protection program, should also be there, so that whatever that the government provide is aligned with their indigenous people's needs. These are the two things that we are doing at the moment when it comes to the recommendation on how the government social protection program can better match with the needs, and therefore can also bring the indigenous communities, including the women and children, to what they are supposed to be. I would like to share two experiences that I think is very interesting that comes out from our project. One is about a young lady, her name is Juliana. Juliana comes from a very remote indigenous community called Suku Anak Dalam in Jambi in Sumatra. She grew up in their community, and she attended what we call Sekolah Alam, the School of Nature. So basically there is a program that is provided to these communities so that they can still enjoy education, although they are still living in their community. So Juliana, young Juliana or small Juliana at the time, joined this Sekolah Alam. And she was one of the most outstanding student, and she was one of the few that is able to enjoy education in the higher level. So she attended the University of Muhammadiyah. She graduated from that university. So she is one of the few of graduates from the Suku Anak Dalam. And with the facilitation of our partner on the ground, she becomes the bridging between what the government service is and with the communities that are being served. So with her education, with her knowledge of her own community, she is able to bring the services better to the communities that are supposed to be serviced. So Juliana is one of our model that somebody from their own community can help the community, but also support, facilitate the government in bringing the services provided. The second is also interesting. I would like to introduce Henny. She's a regular housewife from we call it the Cina Benteng ethnic community. in near Jakarta. So this Cina Benteng is a Chinese minority group that is, they tend to be very poor. And they live in their own community as usual, as you can think about the indigenous community like that. But she was approached by our partner, and she was in agreement to take part in the training. So after training, Henny becomes one of the cadres that help her own community to access the social protection program and social service program provided by the government. So she now becomes a community leader, and she is the one that is helping her own community to access the social protection and social service programs provided by the government. So my concluding remark here is that one, we need to understand the communities, especially this very remote, very underdeveloped community, so that the social services that is designed for the majority of the Indonesian communities will still be enjoyed by them. First, overcome the stigma, and second, contextualize the service. But then even if these two things are already happening, we still think that their own communities should have their own leaders, their own cadres to help bridge the services so that the service provided by the government can still be enjoyed and benefiting the communities that we want to see to happen. So with the support from Inklusi, Estungkara project, our project is able to reach out to a number of communities on the ground so that they can better off and enjoy what the government is providing. But of course, it's not enough because it's not yet reaching out all the communities that deserve the protection, the social services. So we do need to go higher in the policy level and ensure that what we do small in our projects can be replicated and become a policy at the national level. Let me stop there, and I hope what we are sharing here can also inspire others in other countries. Thank you.
Thank you so much, Ibu Nurina. And I know we'll be opening up for questions, quickly, but maybe just a couple of reflections from my side, and then maybe I'll turn to Jackie for the Q&A. I think it's really interesting because what we heard from Cambodia and from the example that you shared from Indonesia is, I think, and we deliberately looked at two very different lenses, right? So we have the policy level, changes that is really looking at the alignment between gender equality strategy and the social protection strategy, like in the case of Cambodia. And then the example from Indonesia was really about this community empowerment and how do you bring that inclusion lens from going, ground up. And, that last point that you made about, going higher up in the policy space to be able to make that linkage. So I guess, what I'm thinking about, and it'll be good to hear from both of you, is how do we actually bridge that, right? Because that's where we need to be able to do both. And we need to be able to have more of that inclusion lens, even in the policy, and then in order for there to be community level change, we do need policies themselves to be gender responsive. So I don't know if you have any reflections on that point, if either one of you would like to come in on that point, any examples that you have to share.
Who wants to start first?
Would you like to go, Ibu Nurina?
Yeah, what I have been thinking is actually we work with our ministry. We have what we call the Ministry for Women and Women Empower and Child Protection. So this is actually a conduit to ensure that women and child protection policies can be shared and integrated in a number of different government policies. So this ministry is supposed to do that, but because they don't have their own big mandates to do on the ground, they have to collaborate with other ministries and with the subnational government. So I think we do have already the mechanism, but we need to make sure that the mechanism is happening, especially in the areas of indigenous people, which is still a small segment in the society that is not well represented yet. So I think we do have the opportunity to work with the Ministry of Women and Child Protection, and we need to pay attention more on how they are going to be able to influence the government policies that are owned or hosted by different ministries and subnational governments. So that's one idea, or actually one strategy that we have implemented so far. Still at the very early stage though, in terms of the success. Yeah, let me stop there.
Thank
Yes,
you.
I
And
do
maybe,
agree.
yes, please come in, Sophie. Yes.
Sorry. Sorry, Shreyasi. I actually agree with what Nurina has raised earlier from the grassroots side, but from Cambodia, we at the policy level, I think it is important to having the enabling environment by having an enable policy that allow to engage women groups or advocacy team to engage in the design, also in the discussion or consultation. This would help us a lot in hearing or learn from the practical challenge at the ground, and also see how we connect and translate those challenge into our policy. Then when the policy put into place, it could be implemented effectively. So for example, the new framework that I showed in my presentation earlier, we did a lot of consultation from at different aspects, from technical, from policy, as well as from the ground. In the technical process, we invite a women working group, we invite DP, we invite government institution, Ministry of Women Affairs. Of course, it's one of our women champion. See, the minister advocate a lot at the policy level when we at the final stage to approve the framework. She advocate to consider and focus on gender responsive. That's why we have the guiding principle. And further on that, we the two ministries have worked together and aligned the priority action plan. So I think by having all of this policy strategy alignment, collaboration between state and non-state actor, as well as civil society, we can address the issue altogether. Yeah, thank you.
Thank you so much to both of you, and maybe back to you, Jackie.
Thank you so much, Shreyasi, Ibu, Nurina, and Sopheap. It was excellent to get reflections and insights from both of you. I found that really interesting to hear. We're gonna move now into some Q&A, and we have a couple of comments and questions that have been raised in the chat, and I'm going to build on those a little bit. So one of the comments that was raised in the chat was that there really is the need for us all to expand our work on collecting concrete and practical examples of how to translate the ambitions of gender responsive social protection into practice. So I'm just wondering whether maybe Sinta or Shreyasi, you could highlight a couple of good practice examples that might have been gleaned through the study, and could you also just reflect on whether there was any learning in terms of the ways in which social protection programs that focus on the women's role as caregiver, and given that there are so many social protection programs that do that, can you reflect on ways in which or examples of where programs have been able to shift towards being and enhancing gender equality through those programs, And then perhaps we'll turn to another question, which is for you, Sopheap, which is connected, which is around the release of the new Cambodia's new social protection strategy and adopting a life cycle approach, and just asking what strategies or arguments have been most effective in moving beyond a narrow framing of women as caregivers to foster women's participation and leadership in social protection design and implementation. So perhaps Sinta and Shreyasi, and then Noreen, if you have views on that too, please jump in.
Yeah, so maybe I can start first, and please jump in whenever if needed. So let me start with Jackie's second question on currently programs are very much focused on women's role as caregiver. So really placing women as mothers, taking the benefits, but really giving them the responsibility to make sure that the benefits are used by the families. So we often say you target women. It doesn't necessarily that you are empowering women, or it's not necessarily that the women are the ones receiving the benefits. And at the same time, we have an issue where care work is preserved or even added by programs. For instance, when you look at programs with a lot of conditionalities, and all these conditionalities are for the women to comply with. So I think some of the programs, for instance, the discussions we have in Cambodia as well, is how do we tweak these existing programs into, a bit more towards reducing and redistributing the care work. The care work is still there, but what we want is the program to help women to reduce and redistribute. For instance, you can add links to care services, and that would can significantly reduce the care work if you have good quality childcare services that you are linking with cash transfer programs, for instance. But also you look at your own conditionalities. How much work are we adding to the women when they are trying to comply to conditionalities? Can we reduce them? And then the next point is, how do these care work, as well as the work you are doing to comply with conditionalities, how can we redistribute? How can we have links to programs that are providing awareness to families, involving men in the program implementation, and conditions in complying to conditions? So these are, for instance, the discussions that we are having in Cambodia is actually really creating cash programs that are cash plus care. So providing the linkages to care services, but also really paying attention to how much care work are on the shoulder of the women, and how can the program help to reduce and redistribute. So this goes then to, I guess, to some extent, to your first question on what are the good practices. So the good practices can take one in tweaking existing programs, which we all acknowledge that that they are giving a lot of care work, or preserving at least care work. But also the other aspect is to expand program focus, not only focusing on women as caregiver. So you have programs focusing on gender-based violence, because we know that the lack of income security is one factor for women not escaping gender violence, for instance, and providing that income security through social protection programs, plus linkages to other programs. And then you have programs that are focused on making sure that adolescent girls and boys have good access to transition to employment and programs that are making sure that women can participate more through income security and through linkages, that they can participate more in economic and political participation activities. So I think that's from me for now. Please, if the others have more comments.
I'm just keeping an eye on the time, but I would love to hear from you, Sopheap, or Ibu Narina, if you would like to add to that question. There's also a question in the chat which is around the work of connecting grassroots women's leadership to ensure inclusion, and whether there's opportunities to better connect that to create a more comprehensive model of gender responsive social protection in the region. We've touched on that a little bit, but yeah, we've probably got another few minutes. So people, Ibu Narina, if you would like to add anything, or Shreyasi, please go ahead.
I'd like to, yes, Shreyasi, go ahead.
No, maybe just to come in on this point around, the examples. I think what we have to recognize, and something that came out quite clearly, and part of the reason why we have this big initiative and, why we're trying to have these conversations in this region is we don't find that, like the starting point, we do find that, it's a little hard to make that blanket statement for the region, but it has been really hard to find good examples where social protection programs have taken that very rights-based approach, like at least from the women's agency perspective, when we're talking about empowerment. And so a lot of the examples that we're seeing, they do tend to focus much more on the caregiving role. And as Sinta was saying, I think that's also fine, which is why we are having this conversation. It's that we can still talk about the caregiving role, but from the perspective that how do we actually support caregiving roles so that women can then be more economically empowered, can maybe, there's a question around girls. How do girls finish their education? Because we know that the care burden is shared by girls as well. It's predominantly also girls and women who are carrying that care burden. So we are starting from a different point in this region. That was a finding that we had, which is all the more reason why we should continue to have these discussions.
From my perspective, being in Indonesia and being Indonesian, I have seen that actually there is, at the big picture, at the macro picture, there is already a big change on how gender and women are being seen in the development. We have now the discussion about, for example, domestic violence. We have now discussion about the number of women that are not educated, that don't have access to education, about inequality in employment, in the salary, that kind of things. So actually, if we want to be honest, the big picture is good enough, but it's not enough. We need to bring it to the next level and look at particular more in-depth issues. So for example, in our case with our Estungara project with Inklusi is looking at the indigenous community. So we are here, but we need to go to the next level. And how to do that is a discussion that, something that we have now is going to add value to the next strategy. Just my 5 cents about that. Thank you.
Thank you. And thank you everyone. Thank you to all our speakers. That has been a really rich conversation, and I look forward to working together, continuing to work together to build these examples of good practice, gender responsive social protection together. I'm going to now ask Jessica Owens, who is a social policy advisor with the UNICEF East Asia and the Pacific Regional Office, to provide some closing remarks, and then we'll wrap up. Thank you, Jessica.
Perfect. Thank you so much. And it's been, I think, a very interesting discussion and getting these different perspectives. So just as we close, I have a few reflections. Maybe first to start on what this landscape has brought us over this discussion. And I think the first realization, and I think we all know this, is that we still have some way to go in the region. We see that the gendered risks and vulnerabilities are still not being systematically included in social protection programs, especially, even if we see them more and more in policies. So this is particularly sort of preoccupying because this will be reflected in our outcomes, in the outcomes that we want to see for both girls and boys and men and women. And this reflects the fact that we still, and this will be through different outcomes, whether it is the coverage rates or whether it is the benefit size, whether it is also the financing. So I think it's an important point to remind ourselves. And the presentation from our partners from Indonesia also reminded us how important it is to get these perspectives from the ground. And I think this is something that we need to remind us to understand what are some of these barriers and the multiple layers of deprivations, of ways to look at, to understand people's risks and vulnerabilities. And this can include whether it is an indigenous woman or a woman with a disability or, so all of these, or a remote or rural person with a disability, trying to understand and bring into our social protection systems these different analysis will support us to be able to better respond to this and ensure better outcomes. So I think that's the first point I wanted to make. The conversation and from our Cambodia example, I think was really interesting, is this effort that it's, we know that we have a region with a lot of social protection programs and systems in place. So we're not starting from scratch. So we do need to look at how do we build on these and bring this analysis in. And the effort of Cambodia is exactly that, is showing this effort to see how we mainstream gender, how we bring the different ministries together, how do we ensure that the data is there. And one of the key issues I think is mind-boggling for me still is the fact that often we see that data, we don't have disaggregated data by gender in social protection. It's so difficult, even our big reports. So it's something that is important, but also in trying to see, using the Cash Plus, how do we ensure that we take into consideration the different issues, such as the care responsibilities, such as the predominance in informal sector work, such as the time poverty that we also see, etc. So these are the issues that we need to bring in. The third one, I think, is something that I saw in the chat, but also that was emphasized also by Shreyasi and others, is just to remind ourselves that social protection is a human right. And it's a human right that ensures that every single person has a minimum income security and access to essential services. And I think, what we're seeing is that in the region, we've seen incredible progress over 2015 to 2024, with Southeast Asia seeing about 13 percentage points increasing in coverage of at least one program. But we still see gaps, and that means a lot of the population is still not being covered by any social protection program, and that the gap between women and men from the different estimations is between 6 and 8 percentage points. So I think these are things that are important to remember. And okay, the final one, because I see Jackie on the screen, is just to remember that that social protection can go above and beyond just providing that minimum income security and contributing to this transformational change for greater equality. And I think this is something that we've seen, that what is really important is that design and implementation matters. And this means it's important to bring in the gender analysis, but also to bring in the partnerships, to work together between the gender and social protection institutions, colleagues, bringing the CSOs that have this ground level insights on what are some of the barriers, so that this is properly done. And the last thought on this is just to say that I think it's a reminder, and I have to also remind also, and I think we do, is social protection is never gender neutral. And we've heard this from several of the colleagues, whether it is reinforcing traditional gender norms, whether it has negative implications or adding to the care burdens. So these are things that we need to be aware of as we think about social protection. But just to thank again DFAT for the incredible collaboration, the incredible speakers today that have really supported us in and been working with us across and trying to see how to move this agenda forward, and also to thank all of the partners, because we have been working in several of the countries with ILO, with UN Women, with UNICEF, and many others that support us move this agenda forward. So back over to you, Jackie.
Thank you so much, Jessica, and a big thank you to UNICEF and partners, and to all the speakers, and thank you also all for joining. I just want to wrap up by saying that following the session, you'll receive a link to our survey, and it would be great to receive your feedback. The webinar recording and the slides will be available to you to access and share soon, along with a link to UNICEF's Regional Landscape Review Report. Thanks again to socialprotection.org for hosting us, and to our sign language interpreters. We really appreciate all of your work and support, and thanks again to everyone. Have a good evening or day wherever you're joining from. Thanks very much. Bye.